Welcome to Caring.
Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well.
Caring Well. Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well, the Middleton Pediatrics podcast where we have conversations to help you care well for your child. Today we have a conversation with Matt Casada. Matt is a counselor here in our community, and he works especially with adolescents. We're going to talk a lot about how he approaches the mental health of adolescents, how he works with his clients. We'll talk specifically about ADHD, executive function, and some other things. So I think you'll enjoy a lot of what he has to say. So let's get to that conversation. All right, Matt, welcome to Caring Well. Thank you. Thanks so much for joining us. Hopefully this will be something really, I know it'll be fun for us, but hopefully it'll be helpful for our parents. And I know you care for a lot of the kids in our practice, and we appreciate you, and we'll get into some of that. But before talking about our topic, tell us a little bit about yourself, somewhat just personal, but then also professional, like how you got to where you are professionally and what a day in the life of Matt looks like professionally.
I'm originally from Knoxville, Tennessee. I moved to Orlando in 2010 to do grad school. Met my wife in grad school. We dated, got married. A week before she graduated, she and I got married. We're in private practice together. We run a practice together with 6 other counselors. I fell backwards into counseling. I thought I would be a youth pastor for my whole life, and kind of hit a point of, okay, I'm not getting fired and I'm not resigning, but just a kind of a mutual realization. This probably isn't the fit for me right now. Not even the kind of work, but just there were things happening that was just making it clear, probably a better next step. And I remember applying for probably 40 jobs. This was during the recession in 2009.
Okay.
And just not being excited about any of the jobs. I was excited about the locations, like, oh, Seattle, that'd be kind of cool. But I mean, I could do the job, but whatever. And so that made me go, well, maybe there's something else I need to look into here. And I had a friend that had done the counseling program that I went to and recommended that. And so moved to Orlando, first time as an adult, not living in the town I'd grown up in. And so it was quite the adventure. And so I've been in private practice since 2012. And then again, I guess in 2015, I fell backwards into teaching. Started teaching psychology, general psychology, developmental psychology at Valencia, and liked it enough, and it seemed pretty clear this is something I'd like to be doing.
Wasn't your undergrad major?
Wasn't my undergrad major. My undergrad major is communication studies.
Okay.
So really enjoyed teaching, and so thought, well, I guess if I'm going to do this, I need to take a next step in it. And so in 2016, our first son was born, and I started a PhD program 3 months later, which, if you want to know if you're talking to a crazy person, that's the first indicator. And so, yeah, my PhD is in counselor education supervision. So first son was born in 2016. Second son was born in 2020 as I was working on my dissertation. So it was quite a chaotic ride through that. So our sons now are 9 and 5. A day in my life is a combination of parenting. Like I'm the parent in the morning that is most prone and likely to be up in the morning and getting our boys moving. And then some days it's a heavy teaching day. Some days it's a heavy counseling day. So like today I had, I guess I had 6 clients this afternoon.
Okay. And when you say teaching, is that supervising or is it lecturing or is it both?
It's both. So right now in my course load, I teach a growth and development class. I teach a career counseling class. I'm in a new institution this fall. So those are the 2 that I remember that I'm teaching.
And growth and development, purely from a psychological perspective?
Whole socio-emotional, developmental. So thinking biologically what's happening, thinking relationally what's happening, emotionally, psychologically, thinking in all of those realms.
Great.
How do people grow and change?
And then the patients or the clients that you take care of, is there a sort of how would you describe the panel?
Yeah.
Typical.
I would say over the 13 years of doing it, it would probably be 50-50 adults and teens.
Okay.
Recently, over the last year, I would say it's probably 80% teens, 20% adults. Specifically within teens, I work a lot with neurodiverse children, teens, young adults. So that usually that means and looks like autism spectrum, ADHD.
Let's focus on ADHD. What, just to start with what you just said, what would be ways, I guess I could probably guess ways that would be similar, but what would be ways your work with someone with ADHD is different than your work with someone else? Yeah,
I think that if you were to videotape sessions and watch, which would be honestly terribly boring,
maybe not.
It might not look a whole lot different. But the thing that always is pinging in the back of my mind with ADHD is the importance of a regulatory relationship.
Okay, you're gonna have to unpack that. Yeah,
and so one of the things that I have found really helpful in the last year is Kurt Thompson talks about the way that the brain develops is ground up right to left.
Okay.
And so ground up, the first part of our brain that comes online is and this is way oversimplifying. Like if you were to talk to a neuroscientist, they would say like, careful here, but it starts with our reptile brain. It's our brain stem. It's at a sensory level, what's going on around me and am I safe at a sensory level? The next thing that comes online is the limbic system, which that's where fight, flight, freeze happens. That's where we're encoding implicitly what's happening between us, what's happening in the room between us, not at a sensory level, but maybe more at a relational level. And then the third thing that comes along is the highest part of our brain, which is the cortex, which that doesn't finish developing until you're 25. What I find, and someone else has been really formative in how I think about ADHD is Gabor Mate, who's an MD from Canada. And one of the things that he talks about, I think the book is called Scattered Minds, is how sensitive many ADHD children and adults are. And I think the point he's making is really attention and being able to focus first happens in the context of feeling at a sensory, and then at that limbic level, I'm safe. And that allows me to pay attention to what's going on. And so it would be easy to think about attention related issues in a top down. Let's talk about how we're thinking about things and how do we organize what you're thinking and how do we help you plan and organize. And we'll talk about executive functioning in a little bit, I'm sure. But really from a ground up, it's how do I make sure that you feel safe and regulated? Because if at a sensory level, you're distressed, you can't pay attention. You can't focus. If at a limbic level, at a relational level, there is distress, you can't pay attention. You can't be present. I was talking with you recently about Amisha Jha, who's a attention researcher, and the way that she talks about it is kryptonite to attention is stress, poor mood, and threat. And so when I'm thinking about and not that I don't think about these things with someone who is neurotypical, but I think the emphasis of really noting how regulated is this, what is the level of stress that they're bringing into the room with them? Where are what is their mood like? Is their mood in a stable place? Is there any perceived threat? Even in coming, like I will often say to teen clients, hey, I'm a random dude with a beard you've never met before, and you're supposed just to come here and open up and talk. Like, that's a little bit weird. And so even just trying to be really sensitive to those things and going, okay, how do I make sure that I am being with you in a way that allows you to be grounded and allows you to be you, so that we can then get to some of the higher order thinking.
Yeah, so I'm wondering so much how you assess and address in that bottom up fashion. I mean, how is it? Are you asking questions about safety and emotional regulation? How are you assessing that?
So much of that is implicit. And so it's felt more than, I mean, there certainly will be times, and less in the immediacy of the moment, but more like there'll be plenty of times I will say, okay, so when you go into that classroom, scale of 1 to 10, where are you at? 1 being cool, calm, cucumber, 10 being I'm ready to flip out right now. So sometimes it is explicit scaling type of questions, but a lot of times it's noticing the nonverbals and being sensitive to, I mean, even things like eye contact. Is there maintained eye contact? What is the rate of speech? What is the tone of speech? And with this, I will say with a teen, I'm always really interested in knowing, like the first question I always ask to a teen is, what is it like to be you? And sometimes they'll look at like, what does that mean?
Right.
But sometimes they'll just dive right in and I love sports. I play video games. These are my friends. And really so much of me being able to be helpful to them is first being able to know, what is your world? What is your place in the world? And I find that really can help students kind of come down to a more calm place. And maybe even like just thinking from a parent place, like, are you familiar with zones of regulation?
Mm-mm.
So zones of regulation, it's an extension of the optimal arousal theory. And I can't remember the psychologist who came up with this, but green, yellow, red. Green zone is I'm calm, I'm stable. I could take on a stressor right now. I could deal with something difficult or stressful right now. And I'm present to what's going on around me. Yellow is I'm a little bit on edge. Maybe on the way here, someone cut me off in traffic and I just feel a little bit tense, a little bit on edge. And not that I can't handle if more stress comes to me, but I'm just more sensitive to it. Red is I've just flipped my lid. I am melting down and I can't make it. On the other end of the spectrum would be blue zone, which is maybe is similar to up here, but just I've got so much going on inside of me. I'm just kind of shutting down. And so even just like for parents thinking about it, it's not really, I don't think it's really hard to think about, I know what Sam looks like when he's in green and yellow and red, or when he's in blue. So parents kind of intuitively, you're able to, even if you're not asking that question, where are they right now? As parents, we usually feel that. And so very similarly, as a therapist, I'm not necessarily in my left hemisphere brain logically going, right now, I think this client is in the green zone, so we can talk about whatever he wants. But it's just a more of a felt sense of, I can feel that you're a little bit distressed or that you're upset.
So you obviously, I'm sitting here thinking you have the benefit of expertise training, the benefit of concentrated, undivided time with this client. I'm thinking translating, because I think what you're saying to some degree, the way you are relating to that client has lessons and parallels for the way the parent should relate to that, harder in a less controlled setting.
Mm-hmm.
So just because you're on that, I'm curious, as far as shifting gears a little bit, how do you sort of equip or guide parents in the way to interact with their children in a way that's healthier and maybe more both developmentally and situationally effective, appropriate?
Two maybe reference points that I would try to build off of. Gabor Mate he asked the question, right now, who's the parent? And he's not asking that in the sense of, is the adult the parent or the child parent, but inside of the adult parent, who's running the show? Is it you, adult wise Matt, or is this childhood Matt that has become inflamed? And I'm out of regulation. I'm in my limbic. I'm in red. Because if I'm parenting from that place, it's not going to be useful. And so some of this is first modeling, practicing for ourselves, let me be aware of where am I at? I think you're aware of the conscious leadership video. Where am I at, above or below the line? And maybe that we can put that in the show notes. Just really helpful way of identifying, am I regulated or am I dysregulated? And one of the points they make is the brain is wired to go to dysregulation. And so when our kids are doing that thing again for the 1,000th time, and we hear in the tone of voice in the other room, oh, this is going in a bad direction, it's easy to flip our lid or to quickly go to a place of dysregulation or disintegration. So the first thing is, can I get wise adult Matt online and model for my sons, even in the moments where I'm starting to lose it, and to say, hey, I need a minute. I don't want to get angry. I don't want to hurt your feelings. Right now, I am angry. And so I'm going to take 5 minutes and then we'll circle back to this. And then for myself, well, do the things I need to do to find a way. And sometimes I'm successful at that, and sometimes I am not successful at that. But really, it starts with modeling for our kids the very things that we're wanting them to be practicing as well. So I think that's a starting place is, can I locate myself and engage with you from a place of, not that I have to be like, I just did a yoga class and I'm peaceful and blissful, but like I'm grounded and I'm not in my limbic brain right now. So I think that's a starting point. And so much of regulation and so much of attention and executive functioning, so much of that is caught, not taught. And so much of it is what we're modeling for our kids.
I feel like so much of the way parenting happens is reactively from things that maybe have never been addressed in the individual.
Absolutely.
And so that makes it a little bit doubly hard that even in a healthy person, it takes some in the moment self-awares. And if I've never dealt with it, whatever it is, parenting seems to be one of the surefire ways it's going to come out.
A mentor at one time in my counseling training said, sometimes the best thing a parent can do for their child that's coming to counseling is for them to be doing their own work. That doesn't even necessarily mean they have to be formally going to, but making sense of what was the way that my parents related to me and how did that teach me how to relate to the world? And how did I learn how to navigate a world that sometimes is chaotic and overwhelming? And and this is where I'm maybe leaning a little bit into attachment theory. Do I generally lean in the direction of, you know what? I just can't count on anyone else. I can only count on myself. And so here it is. It's playing out again. My kids are acting up and I can't count on them to do anything. And so I'm just going to take care of things myself. Is that how I've learned to interact in the world, where I'm a little bit avoidant and aloof? Or have I learned to engage in a chaotic and uncertain world by, I'm not okay unless you're okay. I need to make sure that you're okay. And there's kind of a franticness. So even if it's just a starting point of going, how did I learn to relate to others as I was taught by my parents, can be a really wonderfully helpful and kind thing that parents can do.
All right. Well, maybe talk a little bit more about attachment and remembering your audience. I mean, make it as simple as possible, and also kind of talk about it. What does that look like practically? How does it affect parenting? How does it affect the clients that walk in? And what's a attachment theory for dummies?
Okay. Yeah. From the moment we're born, we're asking the question, am I safe? When am I safe? What happens when I have needs? So the baby cries and learns from the get-go, what happens when I cry? Am I responded to? Am I attended to? What happens when I have needs? There was an interesting research study done called the Strange Situation Experiment. And they brought 3-year-olds into a unfamiliar room with toys. So it'd almost be like bringing a kid into your waiting room here. And mom is in the room with the kid. After 2 minutes, they ask the mom to leave. And what they're really interested in seeing is what happens in the absence of mom, but especially what happens when mom returns. And what they found was typically 3 responses. Response 1 is insecure avoidant, which is the child kind of just shuts down and goes to a place of when mom returns, like, I'm not going to necessarily avoid you, but I'm not going to seek you out because I've realized you're not going to be there for me really when I need you, and I can only count on myself. So it'd be insecure avoidant. And so, like, think about a rom-com movie from 2000. Typically, the male protagonist is avoidantly attached, afraid to really commit, afraid to really be vulnerable and to connect. So that's 1. Insecure anxious is mom comes back into the room and child clings and is crying and distressed, and mom returning doesn't satiate. It's almost like the internalized experiences. I got to keep you close, but keeping you close doesn't fully bring the soothing and comfort. And so I'm going to stay in this place of, I need to keep you here because I'm not okay unless you're okay. The third response is a secure attachment, which is the child becomes distressed. Like when you're 2 and mom leaves and you're by your, like, that's a little bit scary and overwhelming. When mom comes back to the room, there's a quick reconnection. And then after 30 seconds, the kid goes back to playing. And metaphorically, this is what we do with our kids. Hopefully we are the place that as they go out into the world of school, as they go out into the world of the playground, as they go out into the world of interacting with peers, when there is distress, they come back home to me and I can engage with them in a way, attachment theorists would say, where you feel seen, safe, and soothed. Seen, I can see that you're upset. I can have a sense of, based on what you've told me has happened, I can have a sense of what's happening inside of you and have a sense of what it's like to be you when you're on the playground and all the other boys say, I don't want to play with you, and run away. I can have a sense of what happens inside of you. Because I can see you, I can offer soothing comfort and can be with you in a way that says, that must have been really hard. I'm so sorry that happened. And there is something about knowing when I come back to my home base, I'm going to be understood. That allows me to, with confidence, go back out into my world. Okay, what is the difference between attunement and accommodating?
Okay.
Attunement is a means to an end, in the sense of, yeah, I don't want you just to stay here because it is your job to go back out in the world. It is your job to get scraped knees. We were at a playground with some other parents a couple years ago, and I got this great lesson from a dad. Whenever his kid would fall off something, he'd go, "Great fall," because it's our knee-jerk reaction. Oh my gosh, are you okay? And to run and to jump in, and in that moment, if my kid becomes distressed, it may be just as much because I'm freaked out,
correct,
as because they're freaked out. So the goal of attunement is, let me show you that I'm here and that I'm safe, and that when things go wrong, I'll be here so that you can go back out. Accommodating is, let me remove obstacles and difficulties for you so that you don't have to face them. Jonathan Haidt, and this is a little bit in a different direction, but he talks about in his book, The Anxious Generation, we've overregulated the physical world.
Right. Safetyism.
The
and all
safetyism that we, rather than we are going to make things as safe as necessary, we are making things as safe as possible. Which I think is a good distinction. Is this as safe as necessary? Like we don't want our kids on a 20-foot jungle gym. Like,
right.
That's not as safe as necessary. But the only way kids learn how to not get hurt is to be in situations where it's possible for them to get hurt.
All right, let's shift gears a little bit, just more specifically to ADHD, and a term that gets talked about a lot that I would assume is, in your world, you alluded to it, is executive function. How would you describe for us your view on what is executive function, and then how does that relate to ADHD?
Dr. Adele Diamond, her metaphor for executive functioning is it's like a conductor of an orchestra.
Okay.
And I really like this because when we start thinking about executive functioning, there's kind of three different, if we're going to run with that metaphor, there's three different sections.
Okay.
There's cognitive components to executive functioning, there are behavioral components to executive functioning, and there are emotional components. So these maybe are different brass, wind, rhythm. These are different sections to it. And so executive functioning is having oversight and directing all those different things from start or pre-starting a task to finishing it in completion. So things like in the cognitive realm, working memory. Is my working memory online? One of the things when we are not able to maintain attention, I'll circle back to Jaws work in a few moments. When we're not able to maintain attention, working memory is off. It's not online. And so when her kryptonite for this is stress, threat, poor mood. Those things are kryptonite to attention. And when we're not able to pay attention to things, our working memory is offline. Organization, time management, metacognition, thinking about my thinking. Those are all in the cognitive section of executive functioning. In the behavioral section, it's starting the thing, task initiation. So I've prioritized what's most important. I've made my plan. Now I'm going to start doing the thing. I've managed my time so that I'm ready to start with this. And now not only have I started it, but I'm able to sustain attention. I'm able to stay locked in on this for the time it requires me to do that. And that requires the third behavioral thing, response inhibition. Oh, my phone's buzzing. I can ignore that. I can turn off the distraction. When distractions come, I can pivot back from them. And persistence. Can I stay with this task that I have started? And of course, in the real world, there are distractions. There are difficulties that come. So part of the behavioral thing is, can I be flexible with this work that I'm doing? And then at the emotional level, can I regulate myself enough to stay present through all these things? Can I deal with stress as it arises? As I get to that point of my project of I'm not getting this and I'm so frustrated, can I have enough emotional control to either I'm going to take some breaths or do what I need to do to get calm, or step away and say, I'm past the point of being able to effectively do this. I'm going to come back to this in 10 minutes. And then the other part of emotional that's really important is motivation. And maybe we'll talk some more in a little bit about intrinsic versus extrinsic motivation. But so much of kids' world anymore, and I think this is grieving to me, is extrinsically motivation. You do this thing for an external reward. Do this behavior, get this grade, work at this project, go be on this team, be in this club. I see less and less I'm just doing this for the sake of doing it because it gives me joy. And I would say that motivation is really important, but really if you want to develop the muscles of intrinsic motivation or of executive functioning, find things that your kids have intrinsic motivation for.
Are there things you do to help cultivate executive function with clients?
My starting point is there is an assessment tool from a book called Smart But Scattered. And it scores on these different 8 domains. So I'll have the child fill it out. I'll have the parents fill it out. And then I will look at both and go, okay, where is their agreement? Where is their disagreement? And the way that it scores is your 3 strengths and your 3 weaknesses. And the strengths part is important because you really want to, okay, you have you're muscular here. So let's really leverage that. So maybe you're really good at organizing and planning, but starting is really where it's a struggle for you. Okay, so then that helps us know, okay, great. We don't really have to focus as much on the organizing plan. Where we really need to dial in is, what are the cues that we can, in our family rhythm, in our family system, help you best to start the task? Or maybe it's that you're great at starting it, but 15 minutes in, you're on YouTube. And so that response inhibition, that persistence is where you struggle. So starting point is getting a sense of where you're strong so we can really, so where are you strong so that we can really do well, and where are you most weak? What's really important to me is those categories of agreement and disagreement between child and parent. Because where there's agreement, then it's most likely that on both parties, there's going to be alignment of this is something worth working at. So I want to start there. If both the child and parent are saying, yeah, I really struggle with sustained attention. My attention after 5 minutes, it's just gone. Okay, great. We're all on the same page here. So that makes it like, I don't have to argue with one of you to get you to sign off on this. Where it's a little bit harder is if the kid's saying, oh man, I'm great at planning and prioritizing. And the parents are going, I've never seen that kid. He just bounces around from thing to thing. I've never seen him put a thought before he does a thing ever in his life. Well, then that also, as a category for me, is going, okay, that probably is going to be a secondary place, but that's going to be a place that we need to get to because I know that's causing friction between parent and child because there's an incongruence of how they're perceiving it. And so even in this, you're hearing one of the things to me that's really important in executive functioning is it's a collaborative approach. And so much of executive functioning, and I said this before, it's caught. So much of it is caught. So much of it is how are parents modeling this? So maybe it's even modeling something like, oh, I'm afraid I might forget that. So I need to write that down. It's modeling emotional regulation because if those things are offline, you're not going to be able to have good executive functioning. Like I was thinking about this today going, okay, so if the conductor of the orchestra is executive functioning, what happens if a fly comes into the room right in front of the conductor and he starts waving his wand at it? The whole orchestra is going to respond, is going to become chaos. And so, okay, so what happens when stress comes into my life and I'm flicking that orchestra wand? Everything's going to kind of go offline. Or what happens if you're in a symphony and the fire alarms start going on and there are floodlights that come on? The symphony is not going to continue playing because there's a threat. There's something going on that's going to keep the orchestra from working well together. Or say you go out and for whatever reason you're playing a concerto in the middle of summer in Orlando, Florida, where it's hot and humid and your instruments go out of tune pretty quickly. Well, poor mood causes things to go out of tune and chaos ensues quickly. And so again, foundationally, it's mom and dad, can you be regulated so that you can also help your kid? I was having a conversation with someone, started the conversation, we were at a 9, just in a level of how overwhelmed or stressed are you right now? 9. And by the end of the conversation, we were down to 4, and the things that were being said at 4 and the level of thought of, okay, I probably need to do this and I probably need to do this. It was night and day just by being able to come online in that way.
All right, so you talked a little bit about almost like a diagnostic approach to executive function. What about a, quote, therapeutic approach? What are some skills or things you recommend they do?
So first thing, I want someone that's struggling with executive functioning, I want to have some tools in your bag that help you regulate. So maybe first think at a sensory level. I'll often ask kids or parents, what do you find feels comforting on your body? Like for some kids, I find a weighted blanket to be really helpful. I find putting my feet in a cold tub. I find getting in the hot shower for 5 minutes. I find a cool drink of water. Like at a sensory level, what is calming and
it's almost
comforting.
like a reset?
Yeah.
Okay.
Absolutely. And that takes parents being able to reflect back to, hey, I can see that you're in yellow.
Mm-hmm.
I can see that you're in red. I can see that you're moving that direction. And if you have buy-in beforehand on here's your sensory diet of what helps you at a sensory level, reset.
Okay.
That's always the starting place. 12 minutes of mindfulness a day really expands your capacity to maintain attention. Attention obviously is a part of executive function. And I don't think the call to action here is, okay, so parents with your 6-year-old do 12 minutes of mindfulness, but you can begin to incorporate things, even just mindful breathing with them. Mindful moments of like, hey, let's do 5, 4, 3. What are 5 things you can see? What are 4 things you can hear? What are 3 things that you can smell? Or 3 things that you can feel on your skin? Even just things that help you get in the moment. In our house, one of my favorite things to do, there's a specific song that one of my sons likes. And when he is getting to a distressed place, we'll sometimes get in bed. I will put my phone on his chest. We'll play that song on a loop and we'll just breathe together. And that's something that we've practiced when he's not dysregulated, so that when he is dysregulated,
more likely to be able to access it. And
it's not a magic, it's not magic, but sometimes it really is quite amazing, the shift that can happen after 5 minutes of that. Once you're doing that, I think you can think about things like visual calendars, visual checklists, especially for younger kids, being able to have that external thing to rely on, color-coded organizational things for schoolwork and for folders, so that there's less that has to go on in the brain of the child that's already having a hard time organizing. Have external reminders and external cues.
I was telling a family even today that for you to say, have you done this, this, and this, you're still owning the executive functioning. But if you just say, have you done your checklist, you're at least trying to transfer ownership of the executive functioning to the kid. And it feels like the things that we do right, it's a little bit almost intuitive and it wasn't that conscious. And the things that we do wrong are also, I don't know, just these things, to be thoughtful about all this stuff feels really, really difficult.
Mm-hmm. One of the things I'll sometimes say to parents is you can only have so many hills you're going to die on. And the older they get, the fewer number of hills you can really focus on. And so like 16, 17, it's like 2. You can pick 2. 13, 14, 15, maybe 5. And so that's going back to like the initial diagnostic screening. It's like, but if both child and parents are saying this is where that there's a problem, that's the easy place to say this is where we're gonna start, because we're all in unison agreeing this is where there's a problem. And so that's where let's start there. And so yeah, I think that's where there's the benefit of having some external help to organize and prioritize what is the most important place. Like one of the things I'll do sometimes with clients is, okay, let's map out, you get home from school at 4. What would feel useful for you for a reset? Okay, so 30, you get a snack, you're outside, you spend no more than 5 minutes on your phone. Now, how are we going to realistically keep to that? That's a second question. But okay, so here's your first 30 minutes when you get home. Now, this week, let's experiment. Let's say you had the next 30 minutes to work at school. What would be a realistic amount of time that you think you could really be focused before you pivot and take a quick break? So maybe it's, hey, so first 30 minutes home is you're resetting, you're getting a snack, you're decompressing, and then you work 10 minutes and then you take a 5-minute break.
Mm-hmm.
You work 10 more minutes and you take a 5-minute break. And this is where parental involvement is really important, especially with kids that are struggling in these realms. It's one thing to say this, it's another thing to practice it. And what can really quickly disrupt something like even as something that sounds as simple as that is the kid becoming distracted,
right?
The kid not having follow through, like all the executive functioning things that are already struggles. When they start to show up, then it's gone. Or if there's frustration in the homework, then it's gone. And so working with parents to go, okay, here's this going to be the schedule. Let's just experiment with this week. And we'll check back in next week to see how has it gone. And I'd like for you to be around when they're doing this. And so maybe you're the one that's giving them the reminders. Okay, it's been 10 minutes. Let's go do the 5-minute thing that you're going to do. And I'll give you a heads up when there's 1 minute left.
Just to elaborate on the How Children Raise Parents book, I feel like the freeing and beautiful thing was this idea that, our children's lives are a story and we're not the author. And there's a better author than us and we get to play a part. But if you see yourself as the author, then there's a lot of angst. I hope I write well. I hope this story turns out okay. And when it doesn't look like it is, oh no, we got to fix this. Yeah. Whereas if I believe that my child's life is a story and I'm not the author, but I am playing a part, it's a little bit more of an adventure. Like, this is an interesting story. We'll see where this goes.
And to piggyback off of that, I think parents' first knee-jerk reaction when our kids face adversity is to go, "Oh no, let's fix this. I don't want my kid to have to struggle.
This story's not going the way I want it to go.
This story's not going." But that's every good story,
right? Those are the best parts of the story.
The best parts of the story are when you don't know how. I mean, I always loved the part of Two Towers where Sam and Frodo are kind of on the outskirts of Mordor, and they're saying, "I wonder what kind of story it is that we've fallen into." And I hope it's one where the everyone likes to tell, where the hero comes home and everything is good. But I don't know what kind of story we're in, but that's what makes it a good story.
Is there anything about school that, from your vantage point, you wish was different?
Most schools here in Orlando are no phone zone. That I think is a really good thing, and is in line with what Jonathan Haidt would recommend. And I know you've talked about Anxious Generation. I think really helpful book for preteen parents and teen parents. So the no phone thing I think is immensely helpful. Like we've kind of already said, child-directed play, that's physical play, more opportunities for physical activity that is, and not even necessarily like PE where it's structured by the adult, but more time in recess to roam and run and play and get out the energy that naturally builds up for kids. I think being a teacher, I think it's probably always been really hard. For my friends that are teachers, though, in the last 6 years, I can see it seems like that has increased.
Yeah, it seems like part of that. I mean, you feel badly because so much of the metrics that have been imposed on outcomes, and so therefore, understandably, teachers, I think, feel a little bit forced to conduct the day according to the outcomes that are going to be measured.
Yeah. I mean, yeah, and there has to be some kind of accountability in education. But I mean, even for myself as an educator, not with kids, but at the master's level, the worst kind of school is, okay, we got to check this box because we're supposed to check this box. One of the things I often, because I'm teaching adults, I get to ask, why is this important? Why is it important for us to learn this? And to help them do that work themselves. Whereas I think for many kids, elementary, middle school, high school, there's not a good why. And that can be, I mean, even for us as adults, the things that you do because you're supposed to do, well, that can become demoralizing.
Right. The motivation is a little less for sure.
Yeah. And so, but yeah, in my dream world, a lot more intrinsically driven activity that's child directed and physical.
I think a lot of the things you're saying, I would imagine teachers saying, "Oh, I wish."
Yeah.
Well,
and even things like good transitional periods. And I know that teachers work hard to have that, and it's hard when there's a class of 25 kids, but
right.
Being able to have good transition of even, hey, this is kind of like what we were saying with the homework situation. This is our 10 minutes of work, and then we're going to do 5 minutes of.
Are there any books you find yourself, or maybe a book you find yourself consistently recommending to a parent?
Yes. Scattered Minds by Gabor Mate is a great one. Talks a lot about attachment and attunement and how it shows up.
And if you were saying the ideal age of child that a parent should stick their nose in, that would be what?
As early as elementary, pre-elementary, because so much of is similar to some of our the other part of our conversation. So much of it is about how do I, as a parent, be a calm, attuned presence in your, not accommodating, but attuned presence in your life, so that you are set up for as much success as possible.
Okay. Another one?
Yeah. Amisha Jha's book, and I can't remember it off the top of my head. But it's on attention.
This is the one that talks about the kryptonite attention.
Yes.
Kryptonite
Last name Jha.
Okay.
It's a really, I think, insightful book to attention and how to mindfully regain our attention.
And you think that's good for a parent, accessible
Yes.
to? Okay.
Yes. I think Dan Siegel has a Parenting from the Inside Out. I think Brainstorm is his teenage book. Both of like Parenting from the Inside Out is more child through adolescence. Brainstorm is more adolescents. Smart but scattered,
Okay.
I think it's a little, I wouldn't say it's scholarly, but it leans a little bit more in that direction than some of the others, but a lot of helpful resources in there for executive functioning and
Okay.
practical, tangible things to do. That's where the assessment that I use comes from. So that could be a great starting point to understand what's happening in the mind of your ADHD child and some of the strengths and weaknesses and ways to support them.
There are obviously some things that scream and grab attention.
Mhm.
Are there any things that you see teenagers struggling with maybe more quietly that is not even on the parents' radar?
And I don't know that this is a new thing. Part of what's happening in teen years is I'm individuating and moving away from mom and dad. So, I mean, sometimes parents can sniff there's something going on, but I'm not quite sure what. And so I don't know that there's necessarily like a specific symptom or thing that's going on underneath the radar. But sometimes it's maybe a severity thing. Like one of the things, so with depression, you're asking things like, what is your appetite like? How are you sleeping? But for a teen, especially, because those things are changing so much in adolescence anyway. Are you enjoying things? Are you enjoying the things that you have historically enjoyed? And do you care about things? And I think sometimes those are a little bit more covert and a little bit harder to see, especially like you're saying, especially in a busy, action-packed world where every day after school I have activities and clubs and sport. But those to me with a depressed teenager, those are always the two loudest to me. Candidly, I would say probably, I wonder how much parents are aware of pornography availability and use, especially for boys. How early, I think average age of exposure is somewhere between 9 and 11, depending on what study you look at. And you go to a friend's party who has an older brother that has a phone and it's there, and you're 8 and you've been open into Pandora's box. I would imagine, and that's not necessarily a symptom that parents are going to bring their kids in for counseling for, but I think that that's probably a lot more prevalent than maybe parents are aware of or would want to be aware of. I would also say probably, and this is anecdotally, but I would probably say a lot more inappropriate texting happens than parents are aware of. And again, that's not necessarily a diagnostic symptom that's going to be in the DSM, but I just think culturally, those are some of the things that are going on with teens that has a lot of adverse implications.
Is there anything that you would recommend parents maybe make their own habit of saying, or almost a little ritual that they may say over and over to their kid that you would recommend they say that you think can impact in a positive way the child's mental health in the long run?
Maybe this is narcissistic of me, but one of the things I say to my boys often multiple times a day is, I'm so glad I get to be your dad. And I say that, I just started saying it, not even intentionally, but I continue to say it because it's saying I'm the blessed one because of the role I get to have in your life. And I think so anything in those realms that's saying, I'm glad that I get to be in your life. I want to be in your life. I care about the things that you care about just because you care about them. I'll give two other is maybe a cousin to what you're asking. One, talk to your kids in the car. There's a study done that analyzed pictures of women interacting and men interacting. They found generally women interact face to face, men side to side. And I think teens, and especially teen boys, really embody this, that there's something, you might get a little different version of your kid in the car. Because it's not face to face, because where else are you going to be? What else are you going to do? So engage with them in conversation in the car. 1, 2, ask them to play the songs in the car and ask them to play the songs that they are interested in. Because really what they're saying is not, I like this song. They're saying, this is something about who I am and something I care about. And then 3, have some kind of consistent, individualistic connection point with them. Even if it's, hey, once a month on Friday, we're going to go to Waffle House. Hey, once a month, we're going to go do this thing in the evening, but have a thing that is your thing that you do with them. So that's not necessarily a thing that you say, but maybe related because other rhythms that you can infuse.
Yeah, that's great. Good stuff. Is there anything that you find parents having a lot of angst and worry about that you find yourself saying, you don't need to worry about that? That's not as big a deal as you're making it out to be.
Can I say grades?
Yeah.
Now, of course, I'm in the privileged seat of my kids are not in high school, so their grades are not going on their permanent record. And so I certainly understand that is a reality. And I mean, even just, I don't remember the numbers, but saw the small number of students that get accepted in Florida institutions, and it is small compared to the number. So I can understand
where the pressure comes from,
and where the anxiety comes from. My fear when grades and outcomes with grades becomes the focal point, what can get lost is good processes. And really that's the most important thing is resilience and good processes with studying habits, consistency, staying on top of things, staying organized with things. And when there are bumps that come, being able to push through and get through them. And I think those skills are the most important things that pay dividends over the long haul.
Yeah. So let's say there is a parent that said, hey, I would like to take my child to a counselor. Any quick words of wisdom to how to go about finding one?
I think start with your network of people. So if there are other parents that are trusted in your circle, or a school counselor that you trust, or Middleton Pediatrics, if you trust your pediatrician, start with the people that are in your circle that have had good experiences with a therapist. I think that's always a really helpful and good place to start. I think starting with your circle of people.
Are there times that you find, hey, I'm not the best fit for your child and you recommend they move on? Or do you somehow even at the beginning try to give parents some sort of expectations that I may not be? And how do you handle that?
My process at this point in my career is I always meet with parents before I meet with the kid. And that's a new thing within the last 4 years. I'll meet with the kid 4 times, and then I'll meet with the parents again. And that does a few things. Like, I don't intentionally do this, but what I find almost plays out is I'll meet with the parents and get a lot of helpful information. And then it's like mentally it's on the bookshelf. And then I have 4 times of meeting with a kid and I'm getting a lot of helpful information. And then by the time I'm circling back to parents, it's like, oh, okay. So I'm bringing these things off the bookshelf. And now I can look at these things and see where are they stacking up? How are they lining? But then also to hear from parents, what are you seeing at home? What are you noticing? Here's what I have seen. Here's what I've noticed. But the other thing that does is it gives me a touch point to say, I can really tell your kid does not like coming here. I'm happy to continue seeing them. I think if we continue meeting, we'd be doing this, and this. But I so much of it's going to come down to, are they open and motivated to be here? Because if they are not, like, I will do the best job I can on my end, but I want y'all to be really informed on that. And yeah, I mean, many times, and I'm seeing more and more teens and preteens when they come in want to be in counseling than historically I have seen in my career. But there are many teens, especially teen boys, they are not excited to show up in my room. And sometimes that changes and sometimes it doesn't. And so my job is just to be honest and transparent with the parents.
I'm sure there are exceptions, but do you find any broad brush trends in terms of adolescent girls and adolescent boys, and from your chair, and maybe you've alluded to some of that, just the difficulty of engagement maybe with adolescent boys is maybe more, but any differences you see?
Maybe this is a stereotype bias. I do find many for teenage girls, so many of the issues are surrounding relationships, and not that that's not true with boys, but just at a higher level. Like part of adolescence is spotlight effect, like thinking when I walk into the room, everyone is aware of the zit that's on my forehead, but girls seem to experience that at an even higher level than boys do. Not that boys aren't feeling that same stuff, but the social dynamic really plays out a lot more
Do you
intensely
think, would it be accurate to say that girls are often struggling more with difficult relationships and boys with the absence of relationships? So more
I do think
loneliness?
that that's true. I don't know that boys would articulate that as such, but I do think that that's true. Even just in some of the research about how boys spend time, and the number of times that parents will go, "Golly, Johnny plays video games 6 hours a day, but it's the only time he plays with his friends, and so we don't want to take that away. We don't know what to
Right.
we don't know what to do here."
He would have no interaction if
He
we
would have
didn't do
no
that,
interaction with friends if it wasn't for his online gaming community. And so yeah, I think that's probably, there's some truth to that.
I do have some rapid fire questions for you that have maybe nothing to do with anything we've talked about so far. Ready? Best book you've read recently?
Yeah, the Amisha Jha book.
Oh, wow. So that was a recent one.
That was a recent one.
Okay. Favorite restaurant in Orlando?
On a special night, we'll go to Luke's.
Luke's. Favorite guitarist of all time, since you're a guitar?
Oh, Tommy Emmanuel.
Don't know who that is.
He is an Australian guy that is just ridiculous. He's not in a band. He's just a soloist, and some of the most absurd things I've seen a guitar player do are Tommy Emmanuel.
Tommy Emmanuel. I'm sure he's on YouTube at some point.
He's on YouTube.
Yeah. Most obnoxious college football fans?
Oh my goodness. Well, I'm a UT guy, University of Tennessee. Am I allowed to say UF?
Sure. I
Being
mean,
in Orlando?
you're allowed. I don't know what kind of comments we'll get, but of course.
Yeah.
I mean, how does it feel to be the second best football team in the state of Tennessee at this point?
Yeah. Honestly, I was telling someone today, our son was born in 2016, and that was the year I gave up Tennessee football because I just realized this is becoming a day ruiner. It was in the height of really frustrating span of Tennessee football.
So Saturdays were just ruined. And
Saturdays were ruined, and I'm looking over at my infant son going, yeah, I don't think this is a good use of my time.
Well, you should get on the Vanderbilt bandwagon.
Yeah.
One thing you wish every parent knew about counseling?
I will say my knee-jerk reaction is it can take some time. I do more and more get the sense that parents really trust the process, especially if they're in the loop of what's going on.
So you're saying, though, that there's sometimes some unrealistic expectations and impatience.
Yeah, because probably half of the kids that come in and are seeing me, there's some capital C or lowercase c crisis going on. And so there is what do we do? How are we going to fix this? How are we going to address this? And I mean, I will say from the get-go, I tell many of my clients, I don't think you're a problem to be solved. I think you're a person to be known and understood. And then to look at how am I stewarding my life? And it's that part of being known, being understood. That can take some time. And really, it can take some time even for me. I can hypothesize about why is this going on in this 13-year-old kid's life, but there are a lot of factors I need to know. And sometimes this may be shocking to you, but sometimes a 13-year-old boy doesn't want to come in and just talk about their problems. And so sometimes it does take some time. But again, I think the reason I feel really grateful, I'm finding more and more parents are pretty trusting.
Top of your head, rapid response, what percentage of the clients you see do you think should have come in much earlier?
50.
Okay. So not all.
Yeah. I think there are some schools in the area that are doing a really good job of maybe not early intervention, but kind of seeing things, and the school counselors have developed a good relationship with the kids, and then can bring the parents in and say, hey, this may not be an awful thing yet, but this is maybe something to look at.
That's a great point, because it seems like first most likely places of referral historically, I would guess, would be parent and pediatrician. I think as a parent, there's some reasons that it's probably hard to make the step towards counseling. And as a pediatrician, a lot of these kids we may be seeing once a year.
Right.
Whereas school, right? I mean, much more. Yeah. And so if, not to ask even more of the school, but if school could be a sort of a portal through relationships, that's a really healthy model. Yeah. Of school counselors.
Oh, and there is an interesting shift, and maybe I'm taking us on a rabbit trail here. And there are pros and cons of this. One of the biggest shifts that I've seen in my time of practicing is kids' awareness of mental health adjacent things. And in some ways it's good because there's not stigma, and they're going, hey, I'm feeling things and I want to talk to someone about them. That's a great thing. What becomes problematic is an over-identification with symptoms and a self-imposed diagnosis that then I'm going into my algorithms that are spitting it back to me, and it becomes a self-confirmation bias loop.
And there are more and more studies coming out to verify what you just said, that what a kid feeling anxious, they think they have anxiety disorder, that a well-meaning school says, we're going to have a program that talks about anxiety. And now many kids,
more kids have anxiety.
Yeah. I mean, we felt this in second year medical school pathology class.
Yeah.
Like every other disease you study, you were like, oh, I think I have that.
Yeah.
And so you could imagine how the mind works that way, that it's very well intended.
Yeah.
But it may have some unintended consequences.
Yeah.
Yeah. It's hard. Well, we appreciate what you do with you and Ryan and y'all, and people can find you at
LumenCounselingOrlando.com.
LUMEN.
That's right.
Yeah. Well, we do appreciate the role you play in the community. I mean, obviously the title of this podcast is Caring Well. You do that so well. We love people who are committed to helping kids flourish, and you guys do it. And so thank you. We appreciate you.